We are a virtual supportive care model for women in underserved communities, which is where over 80% of cancer patients are seen in the United States. Combining that with care navigation to help them better understand not only their clinical care pathway, but how they can navigate that care and their lives outside of the clinic.
Welcome back to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster, here with my guest, Jessica Thurmond, CEO and co-founder at Athelo Health. Jessica, great to see you.
Yeah, thanks so much. Appreciate it.
Let's just jump right into it. Give me the pitch, give me the brief version. What is Athelo?
So at Athelo, we are a virtual supportive care model for women in underserved communities who suffer from breast cancer. So we focus on providing peer and community support as well as health literacy, solid information that patients can understand, while combining that with care navigation to help them better understand not only their clinical care pathway, but how they can navigate that care and their lives outside of the clinic.
Okay, help me, let's put a face on the challenge. Walk me through what it's like currently, and maybe what it was like, before Athelo came around, for patients who are facing these issues with cancer and emergencies.
I think that one of the biggest issues we face is that people don't realize that not all cancer care is created equal. A lot of people, especially in the healthcare industry and in technology, are accustomed to going to large academic centers that have a lot of tools and resources. And care navigation, to be honest, isn't really a novel concept. There's a lot of research and there's been a lot of data that supports the efficacy and how helpful care navigation can be. We work in a system that's really siloed, and cancer is complicated. There's so many things that you have to coordinate and navigate. It's an information overload on patients. So a lot of these large centers already have care navigators, but for a lot of smaller community centers, which is where over 80% of cancer patients are seen in the United States, they don't have that. And so this is an opportunity for a tool like ours to come in and be able to provide those resources to patients in communities that typically would not have the resources themselves or the time or bandwidth to be able to commit to something like this.
Okay, you mentioned in your initial pitch that you're focusing on underserved communities, so that's part of the platform. So talk to me about that. Why is that important for you?
So one of the things that we think about so much is that oftentimes these are the patients that cost the healthcare system the most money. They are the patients that typically have the least access to resources. They go to places like federally qualified healthcare facilities that are the most strapped for money and time and providers. And so oftentimes they're left to their own devices to navigate their own way. And so these are the patients that oftentimes cannot get the drugs that they need because they can't afford their copay. And they need to find ways that they can better navigate that. And so these are the patients that we feel that we can show the greatest impact in, and also the patients that so often are forgotten. Care navigation is not novel, like I said, at some of these larger places, but within the community setting, it is new and it is different, and being able to also integrate within their workflow has been something that's really important to us, since oftentimes care navigation has existed from within an insurance company or from within a healthcare system, and this is kind of a different model where we then integrate within how they already run things to just help it go smoother and hopefully connect patients faster.
Okay, so your desire to help underserved communities would impact kind of who you go after and who you're trying to partner with. How has it shaped the development of the product itself?
Yeah. So a big part of this is, we do a terrible job in the medical field of making information palatable and understandable to people. Like we have our big, acronyms and all of our medical jargon that we use, and that's really difficult for patients and frustrating. So we've designed a tool that is, really empowers patients. It's a mobile application. It can work across iOS and Android as well as some web capabilities. And what we hope it will do is kind of create a one-stop shop for these patients to have access to resources, as well as for us to be able to communicate back to their care team when something is happening. So the way we've thought through this, we obviously have a huge burden that's been on our healthcare system across the U.S. since the pandemic. And so we have a way of triaging what's happening with patients to where if it's kind of a low or medium risk, that's not something we're going to escalate immediately. But if it's something that we know is urgent, then we can let their care team know, and they can have confidence that it is truly an urgent request that they need to handle right then and there.
Got it. How's it going? How is the market responding to what you're doing? Do you have any sort of examples or stories of people you're working with now that are exciting for you?
So we've been super excited. It's been a journey to get to where we are. We've had different iterations and concepts and pivots, but I think the big thing that resonated for us over the last year is some policy shift has happened,
Okay.
where the Enhancing Oncology Model, which covers Medicare, ultimately started to create reimbursement for care navigation for the first time. So that's been another piece, is that everyone just thinks care navigation is something that's done, but if there's no way to actually bill for it, and it's no way for providers to be able to, compensate for the time that they're spending, then it's not something that's going to be a priority. So with that alignment, we've now been able to kind of start targeting and narrowing in. So we're working with the state of Colorado. We've been super excited to sign our first commercialization of the product with the Office of eHealth Innovation under Lieutenant Governor Diane Primavera from the state of Colorado. We are launching this spring with a hand-selected number of rural clinics that are all publicly funded in the state of Colorado, and we'll be launching to 100 breast cancer patients with a goal of then expanding out across the state to all of the rural clinics that they work with past that point. And so our goal from there is to then take that into other states like the California market, like Tennessee, and be able to start working at a broader capacity once we take that data and show it further.
That's awesome. Congratulations.
Thank you.
How much of a game changer are those shifts in reimbursement? Just kind of put it in perspective for us.
It's huge. So when we started, we were focused more on remote patient monitoring. It made a lot of sense at the time. Coming from a clinical trial background, we do a lot of RPM. The problem is those codes have not moved. In fact, AMA kind of tabled them again for another year this year. So we shifted away from that, because truly, if you don't have a way to be able to get reimbursement for your product, then you have to change, right? So that's been critical. And even if this change in the Enhancing Oncology Model hadn't come forth, we would have been working through community health workers, which was kind of another way that we'd be able to provide these services. But it's really critical, and I think for companies especially that are focused on underserved communities, it's not just about the tech. Like, the tech is great, but if you don't have policy that aligns and the ability to bill for the services that you're providing, you're dead in the water. Yeah. And so we've been really excited to see, the state of Colorado is really kind of on the cutting edge of what they're doing. They had a huge push for screening of breast cancer patients over the last couple of years, which really provided us with a great runway to work with the organizations that had really high breast cancer screening rates to be able to offer further care navigation past that point. Yeah. And in terms of exciting things for the future, we are planning this year to expand outside of just oncology, or not just oncology, but breast cancer, into other areas. So all cancers that impact people with uteruses, and a number of different partnerships as well that we're excited to be announcing here soon.
Nice, nice. Let's shift gears for just a second. And you've been grinding on this business and pushing hard for how long? How many years?
3.
3 years. Okay, I'm sure it feels like 10.
Yeah.
But you've been pushing, and how are you thinking about your own development as a CEO and a founder? How are you trying to make sure that you're growing as you're also pouring yourself into the business?
Yeah. Honestly, the theme of my 2023. We came to a place where we were having to make really hard decisions about what we were going to do, what wasn't working, and those are the times as a founder where you really come face to face with your demons, when you have to accept that maybe what you thought this was going to be isn't going to work. And it's not that it isn't a good idea, but the market is not there yet, and so you have to accept it and move past that. So for me, honestly, 2023 was about taking care of myself. I was advocating for wellness in patients, and I wasn't advocating for my own wellness personally. And so I started boxing in the last year, and I've gotten really into that, as well as just my physical well-being, prioritizing my health. And that really was a game changer, because when the market kind of crashed over the last couple of years, it was really hard on us as founders, as people. The burnout was really challenging. And the fact that I was able to make sure I was sleeping consistently, that I was still working out when I didn't feel like it, I think for me has been one of the most important things I did as a CEO, as a founder, to make sure that my company could continue to be successful. Because if you run out of gas yourself, the company doesn't go anywhere. Yeah. And it also shifted my perspective too on the type of product offerings and how we can better help the patients that we're supporting.
I love that. I love that. Plus, you can bring sparring into your board meetings.
Exactly. Yeah, the investors are looking forward to that.
Yeah. Jessica, I love hearing about what you're building. I know you're working so hard on this. You're going to do a lot of good for folks who are coming in.
Thank you.
I remember hearing at the beginning of your journey about this idea that when someone is told they're in remission, remission. Oftentimes they're sort of pushed off and said, you're fine,
Yep.
until another problem comes up. So this idea that you're building tools that will meet people where they are and give them that help, that guiding hand, even if they're in a setting where they're not at a fancy, expensive hospital, they're in a rural center, and they still have that
Yep.
top quality care. So keep up the great work. Thanks for
Thank you
coming
so
by.
much. Appreciate it, Logan.
Thanks, Jessica.
Thank you.